we are welcoming another friend from a place that we have, to be honest with you, the last couple of months we have discovered is an awesome facility, Jason.
Yeah, very nice. If you haven't been to Broadlawns for 10 years or more, it's totally different now. It's a wonderful place, upgraded facilities, people who are happy to work there, and we have one of them with us today.
Yeah, Jeff Jarding is joining us. He's the Emergency and Trauma Director, and we're going to talk a little bit about that. But before we get into that, I'm going to go off script here for a second, because a lot of people, all of a sudden, the past year or so, are starting to watch more and more of emergency room type TV shows, kind of like the Chicago Med or the Code Black. Yeah. And I want to know what your thoughts are on those.
Well, those are very interesting shows to watch. You know, they have the drama and everything, and they do a pretty good job of staying accurate. The Code Black one actually is pretty accurate, because there is a national
problem with that. You know, explain what that is.
Well,
that's a real thing, right?
Yep, it's looking at your resources, and you get a code green where you're using your resources. You have everything you need. Then you go to, I think, yellow, where you're starting to stretch your resources, and then red where you're at your max, and then black is where you're over your resources. You are maxed out, overusing your resources. You don't have enough in the hospital to treat everybody that's coming in.
And how many times does that happen normally at a hospital?
Oh, it can happen weekly.
We can.
Yes,
okay.
Absolutely.
All right. Well, Jeff, we're excited you're here because we've talked about a lot of the great specialties that Broadlawns is able to offer patients. But let's be honest, when you're heading to the hospital, it's not always because, hey, I have an appointment.
Absolutely.
It's usually because there's something very serious going on and it's an emergency. So how can Broadlawns help people in this circumstance?
Well, there's two things that are important when you're talking about an emergent, or one thing, time.
Okay.
You're looking at time. I mean, it's an emergency, so you want to make sure that you get treatment and be seen. So there's two things I want to mention regarding Broadlawns, and that is, our national average, and this is from door to discharge time, and Broadlawns average is 95 minutes, and as you can see,
so an hour and a half.
So considerably less than what the national average is.
45 minutes less.
And how are you able to
average.
make that happen?
By having the staff and the equipment that we need to treat that patient, and also the proximity we have to the other resources such as radiology lab, CAT scan, MRI, and the collaboration that we have as a team. Get that patient in, get them seen by a physician, get them treated, diagnosed, and back out the door on their regular day. Unless they're more acute, and then we, admit them to the ICU or the med-surg. And by getting those patients that are less acute in and out, keeps our beds open for that next person with the emergency, and also gives us more time to spend with that patient that is more acute.
Okay.
It seems like he has the same attitude as everybody we ran into at Broadlawns, Jason. It sounds like you really are passionate about what you do.
Oh, that's why I'm a nurse. I care about our community. I care about our patients. I want them to have the best experience and get the best care they possibly can have.
How long have you done this?
I've been a nurse for 15 years. I've been at Broadlawns just over 2, and I've been in emergency medicine for 12 years.
That has to be nerve-wracking. Emergency medicine.
As I say, what does it take to have someone who wants to be involved in not always great circumstances every single day?
You mean nursing-wise?
Well, yeah, in an emergency-wise.
Yeah.
You're not coming in knowing that you're going to have an easy day.
Right. A little bit of ADHD, I guess. You have to be able to multitask, and in one room you're taking care of somebody that's having a heart attack, and in your other room you got a patient with a kidney stone, and then in the other room you have a patient with a migraine. And you have to know which patient is most acute, who needs your time right now, but also know this other patient needs my attention as well.
Now, tell us about your crisis team.
Well, we have another statistics we really want to show really quickly. Yeah. So tell us about this one.
Now, this one is our door to doc time. Again, like I said, when you come in, you want to see a doctor, and time is critical in an emergency. And Broadlawns, our current average from the time you walk into the time a doctor's in the room seeing you is 18 minutes.
Wow.
And the national benchmark is 25 minutes. So again, we're beating that. The national, yeah.
Do you have recommendations for people as they're coming in? Obviously, if you're in a state of emergency, everything is heightened and you all feel like you need attention right now. But do you have recommendations for people if they come into an emergency situation, how they can communicate the best way so that they can get treated as quickly as possible?
Well, there's no right or wrong way, like you said, in an emergency. Tell us everything.
Okay.
Don't hold back. We need to know everything, even if it's something that may be embarrassing or whatever. I don't know. Make sure have a list of your medications. That's very key.
Because that determines how you're treated.
Yeah, absolutely.
Because sometimes in that
know.
state of mind, you're not always going to be.
Yeah, if you can keep a list of your medications with you and your allergies,
Okay.
That we can just take that piece of paper and even your medical history and your surgical history. Write that stuff down, no matter how healthy you are.
Okay.
Write all that stuff down because that's going to take a lot of the time away because we can just take that sheet and we can focus on assessing you.
Wonderful. Good information.
What is the ER for? Maybe this is a good time to address this. And what is the ER not for?
Well, ER is for, there's several things we see every day, severe abdominal pain, back pain, chest pains, kidney stones like I mentioned. And it's really for those things that cause enough distress to interrupt your daily activities,
okay.
Or you can't perform your daily activities. Then you might want to see the emergency department.
Okay.
But if it's something that you're able to go about your daily routine, just maybe a little slower, or just you have that sore throat, things like that, that's something, maybe you go to an urgent care.
Okay, let's talk about the difference here. What about insurance when it comes to the ER?
Well,
and you just mentioned urgent care.
Yep. When it comes to insurance in the emergency department, insurance and payment is secondary to your care in the emergency department. When you come in, we want to get to know what's wrong with you. We want to treat you, evaluate you, and diagnose you. After we're done with that, then we have an awesome, very experienced financial team that can come in and talk to you, either if you're admitted in your room the next day, or on your way out the door if you wish to stop by, and they can help get you, make sure that you have the insurance that's right for you. And especially with this Medicaid privatization coming up, there's going to be a lot of questions. And I've never worked with a financial team at any other hospital that is more readily available and has the right answers.
Yeah.
It's great to know. Now, we've been talking about a lot of great things happening at Broadlawns, but if in an emergency situation, what side of the building or where would you go if you're heading to Broadlawns?
It's right in the front.
Right in the front.
Right next to the main entrance. It's the first door, and then you have the main entrance. So.
Okay.
Okay.
But it's
Very readily available.
Very readily
Now, in
available.
case a situation does arise, this is another question that I'm sure you, if you are getting picked up from somewhere and you have to be rushed to the hospital,
Right.
can you request going to Broadlawns?
Absolutely, yeah.
Okay.
That is the first thing that the EMS crews will ask is where do you want to go? And then if they don't have a preference, then the EMS will.
They have a list, or,
Yeah.
or whatever's closest.
Whatever's closest is usually first, and then I'm not sure what they use.
Okay. And Broadlawns, it's easy to get to. MLK off of the interstate or whatever is easy to get to.
Easy to get to, yeah.
Okay. Wonderful. Well, thank you so
Yeah,
much for
thank
being
you for
here.
everything you do.
Good to meet you.
Again,
Nice to meet
just
you.
another star on top of the award when it comes to Broadlawns and what they can do for you.
Yeah, if
Jason.
you haven't been there for a while, check it out.
You need to go check it out.
Yeah,
Yeah.
nice place.